My name is Andrea Fossati, and I'm an integrative physician. I practice at what used to be called Astragalus in South Burlington. And my role there in primary care is to offer integrative medicine consults to patients who are interested in that. In the spirit of full disclosure, I trained in integrative medicine at the Arizona Center for Integrative Medicine with Andrew Weil, and I continue to work with them. So many of my slides and my presentation, much of my presentation, comes from that training, and also from work with my colleagues and fellow students. So what is integrative medicine? Integrative medicine is defined in this way by the Consortium of Academic Health Centers, but if you take a step back and you look at what it really is, it is the thoughtful use of both conventional and complementary therapies for patients' optimal wellness and care together. This is a definition of integrative oncology from Donald Abrams at the Osher Center in San Francisco. He's one of the national leaders in integrative oncology. And the wheel on the right is the Duke Medicine wheel from Duke University. Donald Abrams describes it as the rational, evidence-informed combination of conventional and complementary intervention in an individualized therapeutic regimen that addresses the whole person as they move through cancer. And there are several very important points here. First of all, evidence-informed. What does that mean? It's not evidence-based, not quite the same thing. The idea here is that the evidence required to use a specific therapy should actually reflect the risk associated with that therapy. For example, if I'm going to give you a strong chemotherapeutic agent and it's going to have some significant side effects like neutropenia and peripheral neuropathy and so forth, I had better have some serious data behind it. But if I'm going to recommend that you use breathing techniques, which we all do, that probably doesn't need the same level of evidence behind it because it is safe. Actually, there's a lot of evidence for breathing techniques, but you get the idea. Blueberries, for example. Do we need to have as much evidence for blueberries? We may never have that. Also, something that's super important here is that it addresses the whole person, and it's very relationship-based. So this is vitally important. When I work with people, I don't give them a pill for integrative medicine. I work with them on their lifestyle approaches in every aspect of their world, and I meet them where they are. So my job is to get to know them very well so that we can work together however they want to proceed. The first thing that I say to patients when I meet them, and I love this, is tell me your whole story, which I think is refreshing. Back when I was a cardiologist, I used to say things like, tell me about your chest pain, or how's your blood pressure been? But now I get to say, tell me the whole story. And some people say, the whole story? And I say, yeah, the whole story. And they may start at age 2. And they're 80, and I've had patients literally in tears in the office because they've said, nobody's ever asked me that question before. It's really an honor, actually, to get to have that kind of conversation with somebody. But the whole story may just be the story of, how they developed a certain illness or where their anxiety is, and we talk about whatever it is that they are coming to talk to me about. That opens a door for a real conversation with people. And what we know is that patients who have cancer, generally, somewhere between 50 and 80% of them use complementary therapies. But if we don't ask, they don't tell us, especially if we are traditional practitioners. Patients are afraid of mentioning this to their doctors because they're afraid their doctors are going to say, oh my gosh, you shouldn't use that. And I can say back when I was a cardiologist and they used to bring me all these supplements and say, can I use this? And by the way, on the back of the supplements, it says, ask your doctor. Your doctor doesn't know. And I would say, I don't know. So a lot of patients won't tell us unless we ask. And you increase their rate of telling you from 7% to over 50% if you just ask the question openly. And then non-judgmentally. And here's the catch, you actually have to listen to the answer. Okay, so integrative, there's a lot of sort of terminology out there, integrative, complementary, CAM, alternative, what does it mean? Integrative means that we're using all modalities that are safe and effective together to help optimize health and wellness, okay? Complementary is part of that. Complementary alternative medicine is called CAM. It's not the same thing as alternative, though. Alternative means you're choosing to do something other than conventional care, and that is not integrative medicine. That is not integrative health. I'll just use one simple example. A patient who is diagnosed with breast cancer perhaps may decide that they don't want to have surgery, radiation, chemo, and so forth. They'd rather do a macrobiotic diet. Okay, so that is not recommended. And in fact, it can delay appropriate treatment that is beneficial. So we don't recommend that. Can we perhaps meet that patient and say, okay, tell me about the macrobiotic diet, what speaks to you, how can we use this in conjunction together? Yeah, we can do that. But we do not leave mainstream in order to pursue something that is not beneficial. So what are our goals of treatment? You can come up with slides that have a lot of words on them for this, but I've sort of broken this down to 3 essential goals. One is to improve immunity so that the body can fight cancer best. And there's a lot that goes into that. So inflammation, we know, affects immunity, and we know it affects cancer. And stress affects it as well. So these are 2 basic examples of the foundations we work with in integrative therapies. Also, very important, cancer symptoms and cancer treatment symptoms. It can be cancer pain, fatigue that occurs with 90% of patients. It can be insomnia, which obviously if you're not sleeping well, that has all sorts of other effects in your health and well-being and your ability to fight off disease. Depression, anxiety, and treatment-related side effects like peripheral neuropathies, nausea and vomiting, and so forth, hot flashes. And then this is last but definitely not least, one of the goals is to enhance patients' sense of control and well-being. When a diagnosis of cancer is received, oftentimes that moves the locum of control from the patient to outside of the patient. So now suddenly you're not really the master of your own ship anymore. You need to see your oncologist and your radiation specialist and your surgeon, and you've got to make sure the IV nurse knows how to put the IV in. And so realizing in the midst of that whole scenario that there are things that you can do to help improve your health and help you move through treatment is vitally important. So we help to empower patients. When do we use this? At any point in therapy. And this literally can be from prevention, or I think the term now is risk reduction, because the idea is that you can't really prevent it, but you can reduce your risk. So if a woman has breast cancer and her daughter is 5 years old and they want to talk about how can I reduce risk for my child, going forward in her life, that's a conversation that we can have. Also, obviously, during treatment, there are a variety of therapies that can be used. For example, pre- and post-op mindfulness, guided imagery, clinical hypnosis could be used for things related to like chemotherapy. If you're having hot flashes, fatigue, or nausea and vomiting, acupuncture is very effective. So there are other places in therapy where we can use these treatments. And what are the tools that we use? Well, the basics are lifestyle, nutritional supplements, mind-body therapies, manual therapy, energy therapy, bet you never saw a doctor write that before, whole system traditions like acupuncture, Ayurveda, and really importantly, let's not forget conventional care, because that is central to this. We are not doing all these other things in the absence of conventional care. And to give you a better look inside of the toolbox, I just wanted to give you some idea. This is an incomplete list, of course, but for example, lifestyle might include healthy weight, integrative nutrition, physical activity, stress management, building resiliency, restorative sleep. Sleep is one of the things that I talk to my patients about most. And for example, mind-body medicine or therapies might include things like breathing techniques. We do this in my office, so we do belly breathing and biofeedback and There's mindfulness, mindfulness-based stress reduction. There's a whole variety of possibilities when it comes to any one of these interventions. I love that we call these interventions too, because this is high-touch, low-tech medicine. So let's start with lifestyle recommendations. Healthy weight, very important. Obesity is associated with an increased risk of cancer and also with poorer outcomes. Why is that? What does obesity have to do with cancer? Well, fat cells are very bioactive. They're hormonally active. They release mediators. So when you have more fat cells, you have increased cytokines. Obviously, those contribute to inflammation and carcinogenesis. You have excess estrogen production. So in ER-positive breast and uterine cancer, those occur more often in women who have excess body fat. You have impaired immunity. And this is really super important, this part. Okay, you have increased insulin because your cells start developing insulin resistance. So what does that mean? The insulin's not getting driven inside of the cells. So there's more insulin. When there's more insulin, there is more insulin-like growth factor. That last two words is important, growth factor. Those are growth factors for regular cells and for malignant cells. So what are the guidelines? Well, basically, it's all about balance. And that has to do with intake versus output and maintaining healthy weight throughout life. And if you have excess weight, even during cancer therapy, trying to address that to some degree. Setting realistic goals, of course. It can be especially difficult during therapy for breast cancer, especially with induced menopause, to maintain healthy weight. So it becomes very important. Physical activity is obviously part of healthy weight, but if you look at it separately, for example, what we know is that there is a 25% reduction for women who are most physically active in their incidence of breast cancer. And we also know that women who are more active have decreased recurrence and improved survival rates. So this is part of the reason for our programs like Steps to Wellness here. This is part of the motivation for Kim Dittis and Patty O'Brien starting that program. So which activities? I put this up because the recommendation from the AICR is to be physically active most days of the week or all days of the week, 30 minutes. Okay, so what does that mean? Part of the idea is to choose activities that you love to do that are going to give you moderate or more intensity. Okay, so things like running or yoga, biking, and we're in Vermont. It's about to be 6 months of winter, so I want to remind people that it's important also to stay active through the winter. When I have patients who are a bit frail and can't get outside to ski or whatever, my recommendation has always been, okay, go to Costco. It's nice and warm. There's no ice on the floor there, and it's worth the cost of membership for the year, and you just walk around Costco. Just be careful with big carts. And so my take for patients is really for them to stay in motion. Very, very important to stay in motion, whatever that is. And then, this is great too, because all activities count. So cleaning counts, vacuuming counts. I was thinking of putting a picture of a handsome man with a vacuum cleaner, but I decided against it. So we put the family up there. And this speaks to the idea that we're talking about activity throughout the course of your life, as long as it's moderate or greater. And from a cardiac perspective, that means about 4.5 METs, which is housework. What is the role of nutrition? In a JAMA article in 2010, dietary factors was the #1 risk factor for death in this country, diet. Okay, when you look at the factors of diet, what does that mean? Well, it means diets that are low in vegetables, fruit, whole grains, seafood, milk, fiber, all the good stuff, right? And it also means diets that are high in standard American diet, which we call, in Arizona, we call it the SAD diet. So diets that are high in red meat, processed meat, trans fats, high sugar, especially sugary drinks, all that stuff that we intuitively know is like not good for us. Go to the county fair and just spend like one evening there, and that is your standard American diet, and it's not healthy. I mean, once in a while, okay, but every day, not okay. 35% of cancers may actually be related to what we eat and what we do not eat. And so I just ask you to look at your own plate. Like, what's on your plate, right? In the top left corner there, I think those are Apple Jacks, I'm not sure, from when I was a kid. And that plate is certainly not as well balanced as the one in the center that has ripe tomatoes and lycopene and beta-carotenes in the carrots, or even the yogurt that has probiotics in it and calcium. So not all plates are created equal. And in breast cancer, it is actually suggested that if all women follow these recommendations that we've just talked about with regards to lifestyle, we could prevent 89,000 cases annually. So this is not small. Okay, lifestyle is something we do each and every day, and it builds up. It's who we are. You are what you eat, you're your activities, you're your stress management, and so forth. So very, very important to remember there's something we can do about this significantly. Okay, so integrative nutrition, what does that mean? I love this quote by Michael Pollan, who wrote The Omnivore's Dilemma, and I think the last book was Cooked. Eat food, not too much, mostly plants. And when you get down to it, these are basically the recommendations, but we're going to get a little more fancy than this. This speaks to the whole idea of food as medicine, right? Every piece of food that you put in your body becomes you. If you eat healthy fats, that's what makes up your cell membranes. If you eat unhealthy fats, that's what makes up your cell membranes. It's up to each one of us to decide what that means. So from an integrative perspective, we love whole plant-based foods. I just want to make a note here that, remember, the high sugar thing was not good for you. So if you're juicing and you're just juicing, not good. Okay, sounds like it would be good. It's got phytonutrients, but it's packed with sugar. You're not getting the fiber content. You're getting a blast of sugar, then you're getting a blast of insulin and insulin-like growth factor. So really important to put everything in perspective. Can you have juice? Sure you can have juice. Just have it with the pulp. Okay, organic. I love this. When I Googled this, there was a study in 2012, I think, in Britain that talked about organic versus industrial vegetables, like which one's better. And so if you Google it, you can try this for fun. You find like all these websites that say organic's better, and then you find all these websites that say it's not better. So it sort of depends on your perspective. But what they found is organic foods have more phytonutrients, okay, fewer pesticides, but the macronutrients is the same. So it's up to you, right? We also like to recommend variety, so that whole idea of like eating your rainbow, and that's because the phytonutrients or antioxidants are different based on the different colors of your berries or your fruits or your vegetables, and it's believed that they work synergistically together, and there are thousands and thousands of these. So how do you isolate just one? How about you just have a fruit salad? It's a better idea. So the other idea behind food recommendations is this, that with regards to the prevention task force, the whole idea is if an intervention, sounds like integrative medicine, is low risk, okay, but has the potential for having benefit, then we recommend it. So if it sounds like green tea trends towards decreased risk of breast cancer, we're recommending green tea. And then this is super important because we're going to start talking about supplements, and I think people get confused about this to some extent. But when you take a blueberry, for example, and then you say, oh, this is a magnificent blueberry. What is so great about this blueberry? And then scientists take out like that one anthocyanin and they go, this is it. This is the one, right? And then they multiply it like 5,000 times and they put it into a supplement and they give it to you. Is that the same thing as a blueberry? No, it is not the same thing as a blueberry. And we don't know what the effects of those are. So it is not a replacement to take a supplement instead of a whole food, okay? And it is not recommended in most cases. This is just a chart to show you that phytonutrients come, it's a really tiny example of them, but it's to show you that they come in all sorts of different colors, and the different colors have different actions. So even with regards to potential anti-cancer effects, if you're eating a bright berry versus a piece of broccoli, they are all antioxidants, but there are other effects that can be enlisted. Okay, so what are the recommendations? We have some idea of what the AICR will say. Avoid sugary drinks. It's way high on the list. Increase plant-based foods, and we've talked about this. They say 5+ servings a day. I think 7 to 9 is a good goal. Excuse me. Limit consumption. We haven't even talked about this yet, but limit consumption of red meat and avoid. This is a very strong word for a summary recommendation, right? Avoid processed meats. So why is this? First of all, red meats contain heme, and heme is associated with cancer risk. Not the same thing as iron. Iron is not associated with cancer risk. Also, red meat, when you grill it, which I admit I love to do, it burns the flesh, and you wind up with heterocyclic amines. And heterocyclic amines are compounds that are shown to correlate with cancer. So I think there was a nurses' health study where they showed that nurses who had more well-done meat didn't do as well, kind of thing. They had more cancer. So what can you do about that? Well, you can have a kale salad with your red meat. You can eat it less often. Mediterranean diet recommends it like once a month, not once a week. You can marinate it in oregano oil, which apparently decreases the heterocyclic amines. So there are some things that you can do, okay? When it comes to nitrates, which are in processed foods, so we're talking bacon, salami, bologna. Does anybody remember bologna? I actually remember those. You're not supposed to eat that because that does correlate. So what do you eat instead? Well, vegetarian sources of protein are great. Deep water fatty fish is great. Cold water fish is great. And chicken, especially organic chicken, is recommended, not regular chicken, because those chickens don't grow up in a nice life, and it's pro-inflammatory. Okay, so the other thing, last but not least, is if you do drink alcohol, to limit your consumption. And that means 2 drinks or fewer per men and 1 or fewer for women. And when I was in cardiology, my patients would get really bummed because I'd say things like, do you drink? How much do you drink? And a glass of red wine, sure, it's good for your heart, but the serving size is 4 ounces, not 8 ounces. It's 4 ounces. That's 1 drink. Okay, so what can we actually eat? This is from the Arizona Center of Integrative Medicine, and I love this handout. It's one of the ones that I share with my patients, and I can make it available to you after the lecture on some sort of Dropbox. But anyway, what is safe and healthy to eat with breast cancer and also in preventing breast cancer? So these recommendations are pretty much all based on meta-analyses. Omega-3s are great. So when they look at women who eat more fish and have higher omega-3 content in their diet, there is a decreased risk of breast cancer. When we look at omega-3s, there's a couple of active components. DHA and EPA are the ones that we use in human form. DHA is particularly important for a variety of reasons. Flax seeds also contain omega-3s. They are a slightly different kind of formation, and we have to convert them to the kind that we can use. But flax seeds are still great. You have to refrigerate them, grind them before you use them, and so they might be a little bit labor intensive, but they're good. They contain phytoestrogens and lignans, which are also thought to decrease breast cancer. Olive oil. There was an olive oil study. I'm Italian. I think it must have been done in Italy. It was almost 40,000 people, and what they found is people who have more olive oil had less cancer of all sorts. Okay, soy. Soy used to be a bit controversial, but at this time, the AICR has actually come out with recommendations for 1 to 2 servings of whole soy foods per day. So what do we mean by whole soy foods? We mean tempeh, we mean soy nuts, edamame, tofu, and even soy milk. I don't know about soy sauce, so I'd have to look that one up. But what we don't mean is soy burgers, soy isolates, Luna bars with soy protein in them. That is not soy. That is like a derivative of soy, and it doesn't have any definitive health benefits and potentially could be harmful. So we don't recommend that. When we look at cultures that have whole soy foods in their diets, we look at Asian cultures, and the risk of breast cancer is much lower in those cultures until they move to America, adopt that standard American SAD diet, and within 1 generation they have the same high incidence of breast cancer that we do. So that is, significant. It means something. And we think that it also has to do with having whole soy foods during childhood and adolescence, especially because in adolescence we have breast development. So if you're using soy at that time, it can be protective. There are studies that show that it improves outcomes in post-treatment women for survivorship, both in ER-negative breast cancer and ER-positive breast cancer on tamoxifen. So it is safe to eat whole soy foods when you're taking tamoxifen. It is not the same as soy isolates, but you know that already. Okay, cruciferous. What does cruciferous mean? It means they have a little flower with 4 petals that look like a cross. I thought that was kind of cool to remember that. But basically, there's this whole class of cabbage and broccoli-like and mustard-like vegetables that, when they look at meta-analyses, seem to decrease the risk of breast cancer. So the more you eat, kind of the better. However, cruciferous vegetables actually are goiterogenic, which means they can interfere with the creation of thyroid hormone in your body. So, okay, now what do we do? Well, I wouldn't eat 8 pounds of broccoli a day for a bunch of reasons, but I would also lightly cook my cruciferous. And the reason for that is it denatures the goiterogenic molecules, and basically you're fine. So cook your broccoli. If you're going to eat a lot of broccoli, make sure that a lot of it is cooked so you don't get yourself into a different kind of situation. Again, this is not the same as isolates. So what happens is they go in, they go, oh, the sulfonifides or whatever, and the I3Cs, that's the best part. Let's make this. And we don't have any data that supports that that is healthful. So that's not what I give my patients. I give my patients food. And that's the whole idea of pharmacy with an F, F-A-R-M-A-C. Okay, so cruciferous, there's lots of different kinds that you can eat if you don't like broccoli, and I think it's kind of interesting that it does include mustards. So if you're up for 3 servings a day of wasabi, you're good. Okay, seasonings. Let's talk about a little bit, just giving a nod to garlic, onions, ginger, and turmeric. So these are all potent anti-inflammatories. In meta-analyses, they look and see that people who eat more garlic have less breast cancer. People who eat more onions have less colorectal cancer. And turmeric is a superstar, so we're just going to focus on that for a sec. So this is the exception to my rule. There's usually some sort of exception, right? When we look at turmeric and we look at the really super bioactive compound in there, we are looking at the curcumins or the curcuminoids. The oid part just means that it's an alkaloid. Those are the active constituents, and they make up probably 4% of turmeric. So if you're just trying to get what you need from diet, that may not be enough. And in studies looking, for example, at colon cancer and familial polyposis, they are using curcumin extracts at a dose of 500 to 1,000 a day, or maybe even more. And there's some excellent data. What we love about curcuminoids, and I love this table from Yale, is that there are so many different ways of targeting cancer. So there are COX-2 inhibition, there's tumor necrosis factors targeted, HER2. There's all sorts of ways that it can be beneficial in decreasing the risk of cancer, or even maybe reversing cancer, because there's some studies out there that have shown that. So the NIH is studying curcumin quite a bit. When I was in fellowship, they were doing 30 studies. My guess is they're probably doing a lot more than that now. Okay, another superstar in the food world for cancer is green tea. There was a study in 2005 that trended toward a decreased risk of breast cancer if you had 5 or more cups of green tea a day. So why not? Just remember it's 50 milligrams of caffeine per cup. So that's 250 at the end of the day, and you may want to have some decaffeinated green tea. It's made from the same stuff as white tea, oolong, and black tea, but white and green are higher in flavonoids. And EGCG is the specific bioactive compound, not the same as taking a supplement. And finally, alcohol. So alcohol consumption is directly proportional to breast cancer risk. So if you're drinking several drinks a night, you are at increased risk. And if you're drinking in survivorship, you are at increased risk for recurrence. So maintaining a lower alcohol consumption, if at all, and for women, that is 1 or less, and that's 4 ounces of wine, not 8 ounces of wine. Okay, so supplements. This is like healthy living any day of the week. I always go in there and I always see people doing this. And I think the idea is like, what supplements should I be taking? Well, according to the American Cancer Society, there is no evidence, and we've touched on this already, that supplements themselves actually prevent cancer, and in some cases they can increase it. And that is true. There have been some very directed studies, for example, with high-dose beta-carotene and the effects on lung cancer, and that can increase in smokers and head and neck cancers and so forth. So there are some studies on very specific high doses of supplements. So what does that mean? Because there's thousands and thousands of supplements on the market. Well, basically, is there a way of having safe and effective use? And I would say, yeah, it depends on what supplement you're talking about. In almost every patient I see, we discuss the use of vitamin D and omega-3s. So vitamin D, let's start there. There's a normal level that's 30 to 100. That's a huge range. And I cannot tell you how many people I check, and nobody has normal vitamin Ds in Vermont. I mean, like 80% of the Ds that I check are low, okay? So if vitamin D receptors are present on many, many tissues of the body, like heart, blood vessel, breast tissue, then shouldn't we have a normal vitamin D level, one would think, okay? Is there an optimal D level? My personal goal for patients from a functional medicine standpoint is to get their D to about 50 to 70, which is a really nice, robust mid-range. But there are some people who say higher is better, and I think the data is out with that. And patients who have normal levels in that 30 to 100 range have better outcomes with breast cancer. Okay, so it's still not clear whether supplementation is beneficial. And there is an ongoing study at Brigham and Women's. The study is closed, but they're continuing to look at this with replacement of vitamin D, I think 2,000 IU a day and 1,000 milligrams of omega-3 daily to see if there's a decreased incidence at the end of the day in cancer, heart disease, and stroke. And we're still waiting for those results to come out. So omega-3s is the other half of that. That's what you get from fatty fish. And I love omega-3s because they are an essential fatty acid that damp down inflammation. We all eat omega-6s and omega-9s like prevalently in our diet, and those can be pro-inflammatory. So if you see a supplement, by the way, that says omega-3, 6, and 9, get rid of the 6 and 9 part. You already get that in your American diet. Just take the omega-3, okay? So we want to change the balance to be more in line and less pro-inflammatory. And actually, anti-inflammatory would be great. So 1,000 milligrams a day is generally what I use. And again, it's being studied in the VITAL study. There's many herbs and supplements that patients take, especially with cancer. This is Astragalus. It's a plant. You actually use the root. But anyway, just to give you an idea, this is a very, very incomplete list. So what are the concerns when it comes to using botanical medicines, which were really the original medicines, and supplements? Well, one big concern, especially from conventional medicine, is that there are drug-herb interactions, and there are thousands and thousands of products on the market, and we cannot study all of them. And these are not pharmacology studies because we don't have, people who produce a lot of these supplements are not making tons and tons of money. So it's hard to fund studies on them. Data is emerging, but the truth is most of them will never be studied. So we look at broad categories. One is the cytochrome P450 system, which, as you know, is part of the liver metabolism system, and many, many drugs are metabolized in this system. So if you use an herb or even a food that affects the cytochrome P450 system, you can have an imbalance in your regular medications. The classic example of this was that grapefruit thing. So they found that people who ate lots of grapefruit or drank lots of grapefruit juice had like really high doses of statins in their blood, and they were getting all sorts of side effects. Why is that? Because the grapefruit juice was slowing down the cytochrome P450 system, and the statins weren't getting metabolized and out of there. Also, there are some drugs and there are some herbs and supplements that can increase anticoagulation, and so that's important to be thoughtful about. And some have phytoestrogen effects. I found this cartoon, and then I changed the caption. And this is just to remind us about the grapefruit and the cytochrome P450 system. Okay. Antioxidant is also an important part of this. So the idea is when you do chemotherapy or radiation therapy, part of the way it works or is thought to work is that it creates oxidative stress to kill the cancer cells. So if you are now preventing oxidative stress by giving an antioxidant, are you going to impact the outcome? Well, maybe, and theoretically maybe it's tumor protective, but in the pharmacology world, when Mesna and amifostine came out, which are both antioxidants that are manufactured, they did studies, and guess what? It improved treatment efficacy and protected normal cells from having toxicity. So the jury's still out, but it's one of those things that we discuss with patients. Timing is, of course, everything, and also it depends on your goals of therapy. So if you are giving a patient an antioxidant, okay, of some sort, then there is a 3-day window in which you should not give it to them. The day before, the day of, and the day after treatment, okay? And that's if your treatment is for a cure. If you're using treatment for palliation, it changes the game a little, because if you can do something that's going to help with the quality of life and they're still having treatment, I would say that it's probably fair to continue using that supplement. Okay, so we know what the possible bad things are. What about the possible benefits? We're going to go through this very quickly. Astragalus is that beautiful plant that I showed you before. It's got a deep root, and if you go down to City Market, you can get these Astragalus roots. They're cut up, and they look like tongue depressors, and they're very kind of grainy. People use this by putting it into soup and cooking with it, and it's thought to boost the immune system. And there are naturopaths who use this all the time during cancer therapy for their patients, and it can be quite effective. But what I like about Astragalus is that they're just starting to come out with some studies. These are tiny studies, and not even all human studies, that show they may be beneficial in other ways. Okay, so it supposedly boosts the immune system. We need more data, but it's one of the things that's out there. Ginger is the one that you're going to hear the most about. It is prokinetic, which means it moves things along in the gut, and because of that, it is a very effective antiemetic, meaning it decreases nausea and vomiting, especially that associated with chemotherapy. So what's great about ginger is it actually binds the same serotonin receptors as Zofran, which is a pharmacologic, right? So kind of cool, same mechanism action, but it's a root, it's actually a food. And dried ginger, this I learned during my fellowship as well, is way more potent than fresh ginger. So if you want to get the effects of ginger, make sure it's dried ginger. More is not necessarily better. The dose is about 1 gram a day, maybe a little bit more than that, up to 1.5 grams a day. And I have my patients use traditional medicinal teas because I love that tea company. It's all organic, and they generally use the appropriate dose. So if you brew 1 strong tea bag in the morning, you can divide your dose and throughout the day sip on it, and that should help with the nausea. Okay, ginseng. This is up and coming. There's a couple kinds of ginseng. Panax is Asian ginseng, and then there's American ginseng. Love ginseng. It is what's called an adaptogenic herb, which is thought to improve the resiliency of the body to stress. So I love this. Mayo Clinic did a trial of fatigue during treatment. So 90% of cancer patients have fatigue during treatment. What do we do about that, by the way? It's really hard to treat. So 340 patients, 60% were breast cancer patients, and they got 2 grams of pure American ginseng. You have to be careful about the kind you're using. Pure American ginseng daily versus placebo. So at 4 weeks, they had similar amounts of fatigue, but they continued to take in, and at 8 weeks, they had 20% less fatigue. And this is Mayo Clinic. There were no side effects. This did not interfere with treatment. There was no downside to it. So there you go, American ginseng. I love it. Medicinal mushrooms are also up and coming. Traditionally, they've been used to improve immunity, And there are many studies that are coming out that show anti-cancer activities. Generally speaking, reishi, turkey tail, cordyceps, maitake, and shiitake are the ones that are used. I put this particular company up because Paul Stamets is a national, international expert on food mushrooms and medicinal mushrooms. He's the one. So when he puts an immunity blend together, I trust it, and it is something that I would consider using in my cancer patients. This is a very small just example of studies. I mean, some of these are tiny, like there's one with one patient, there's a couple with 300-something patients, and it's on one species of mushrooms, and it's from a review in Brazil several years ago. But it just gives you the idea, like all of these phytonutrients, that there are various targets for anti-cancer activity. I love milk thistle. Milk thistle is traditionally used to protect the liver. And what I love about this is in a study of 50 kids, all with ALL, who are having liver toxicity from their treatment, they divided them into those who got milk thistle and those who didn't. And what they found was those who got milk thistle made it farther in treatment or completed treatment more often. And incomplete treatment is obviously associated with worse outcomes. So if there's something we can do that is low risk, that helps them get through treatment, then let's do it. Glutamine. Changing over to supplements here. So we've gone from the natural botanicals over to the supplements. Glutamine is a bit controversial. It is kind of cool. It's an amino acid that is conditionally essential, meaning most days you have enough glutamine. But if you're injured or very ill, you can't turn it over fast enough. You can't create it fast enough. So then you may need to supplement with it. There is a lot of peripheral neuropathy out there from the Taxols, and it can be extremely painful. Glutamine has been shown in small study to really radically decrease the risk of peripheral neuropathy. Okay, but here's the thing. Glutamine is an amino acid, so does it feed the cancer cells? We don't know. It's a conversation that needs to be had with any patient you start glutamine on. And the dose is pretty high. It's 30 grams a day. Melatonin is one of my absolute favorite supplements. It is naturally secreted by our pineal glands. It's part of our own hormonal system, and it's something that signals dark and it's time to go to sleep. It helps set our circadian rhythm. There are studies that show that people who have a lot of shift work, God help us, because in medicine, of course, we've had that, but people who do shift work have dysregulation of their circadian rhythms and less melatonin, and this may be correlated with increased cancer risk. So melatonin is very commonly used in herbal approaches to cancer care in high doses, as high as 20 milligrams or more, so 40 milligrams sometimes. A normal melatonin dose when you go to sleep is like 1 or 3. So the biggest issue is daytime sleepiness. You start at a lower dose and you boost it up over several weeks, and patients do well. They might also have super vivid dreams. In a recent meta-analysis of 761 patients with solid tumors, it improved remission rates, survival at 1 year, and also decreased the side effects of radio and chemotherapies. It's thought to be a powerful anti-cancer medication. In addition to other things that it does across all cancers. And again, no real side effects, vivid dreams, and maybe a little bit sleepy, but that wears off. And interestingly, it is also an aromatase inhibitor, so maybe there's some extra benefit with breast cancer. Okay, so we're going to completely switch gears and wrap up with the other kinds of therapies. So mind-body therapy is very important in cancer care and chronic disease care. Why do we use it? Well, it really helps with stress reduction, management of side effects, and overall quality of life. We know that there are relationships between stress and inflammation, and stress and cancer. Catecholamines, which are the stress hormones like adrenaline, influence tumor progression, they increase inflammation, and so forth. So they have a hand in cancer. Cortisol, which is secreted over and over again, especially with chronic stress, also affects immunity and inflammation. And the relaxation response, which was really first noted by Herbert Benson at Harvard, is known to be elicited with mind-body interventions, and it promotes healing. This is really important for these other kinds of therapies because it is the common denominator. What do we mean by mind-body approaches? It can be many different things: social support, group therapy, journaling or art therapy, sort of expressive therapy, guided imagery or clinical self-hypnosis, meditation, mindfulness, even breath work, biofeedback, yoga, tai chi, and so forth. In one small study of cancer patients before surgery, so before breast biopsy or lumpectomy, in 200 women, they got a 15-minute intervention of clinical hypnosis 1 hour before surgery, and the controls got talk therapy for 15 minutes. What they found in the hypnosis group, this is very important, especially if you're sitting on a board at an insurance company, is that these women required less OR time and less anesthesia than those who do not get hypnosis. Okay, they also just felt better. They had the same amount of pain medicines but reported less pain. And so when you save time, you save money, and when you save money, insurance companies become interested in helping to support this kind of thing. So this is back in 2007, so I'm guessing $770 savings per patient for that 15 minutes is probably more like $2,500 now. Okay, massage in cancer care. Massage therapy, much like mind-body therapies, is excellent for stress reduction and anxiety reduction. It is also studied and shown to be of benefit for pain, fatigue, and of course lymphedema. There's a large uncontrolled study at Memorial Sloan Kettering, which was based on self-reported surveys, and they showed that in almost 1,300 people, symptom scores decreased by 50% 2 days after massage. So it is one of the things that is recommended by integrative oncologists, and it's recommended to decrease pain and anxiety, and that it be done by an oncology-trained massage therapist like they have at Dana-Farber, which we visited, and it was pretty cool. Massage for caregivers, I just want to give a shout out to Janet Kahn, who's a dear colleague of ours on at the Program for Integrative Health here at UVM, and she is nationally known in massage research, and she's an advocate for integrative therapies. She helped create this DVD set and book that is geared towards people taking care of loved ones at home and offering them massage at home for patients with cancer. And acupuncture. This is part of traditional Chinese medicine, which is a whole system of medicine unto itself. For a long time now, for 17 years, acupuncture has been recognized as effective treatment for chemotherapy-related nausea and vomiting. But it's also effective for a lot of other kinds of things that come with cancer and cancer treatment. It's very effective for insomnia. It's effective for fatigue, for musculoskeletal symptoms with aromatase inhibitors, or for hot flashes with aromatase inhibitors. It's very safe, very effective, and widely used in integrative cancer programs. There are some relative contraindications. I would not say that this is a definite contraindication, but an absolute neutrophil count of less than 500 or a platelet count of less than 25,000. However, in a study of children who had cancer and platelets of less than 20K, they did just fine with no bleeding. So it's a relative contraindication. These needles are tiny. And finally, energy therapies in cancer care. So healing touch, Reiki, therapeutic touch, Qigong are highly, highly requested by patients and their family. And whether you believe in the biofield theory or not, and if you're taking a completely Western medicine sort of scientific stance, there are definite recognized benefits. And guess what they are? They elicit the relaxation response, right? So it decreases anxiety and promotes healing. And actually, this is a really nice picture of a healing touch session. It doesn't look like lights all over the place. It's just one person touching another person. And in a cervical cancer study that looked at relaxation techniques versus healing touch versus standard care, okay, in 60 women who had a new diagnosis of cervical cancer, they were all depressed. They all had 6 weeks of therapy coming, and they all had 4 sessions per week. What they found when they measured factors was that the healing touch patients had preserved their natural killer cell function, okay, whereas the others hadn't, and their depression had resolved, whereas the others may have improved but not resolved. So there's something to it. So wrapping right back around, sort of a summary slide here, when we talk about what patients can do to help with their own well-being and have a sense of control over their own process, they can control weight, eat healthfully, get regular activity, use appropriate supplements with guidance. They can learn mind-body therapies and use those. They can connect and get social support and partner with an integrative practitioners who can help them along the way. This is available here. So we have a Vermont Cancer Center programs, and I love this picture because this is my dear colleague Kim Dittis, and she and Patty O'Brien were pioneers in starting Steps to Wellness here, which is the oncology rehab program, in a beautiful space over in cardiac rehab after hours once a week. And they talk about these exact kind of things and get patients active, because remember, women who are active do better, right? We also offer psychological support services, nutrition counseling, healing touch, and mindfulness meditation with Roz Grossman. She's an amazing asset to us. She trained with John Kabat-Zinn at the University of Massachusetts and offers a mindfulness-based stress reduction program here for patients and their families. I highly recommend. And then finally, for the providers out here in the audience who would like more information about this, again, Arizona Center for Integrative Medicine has a great website, and if you get in there, they have a course that can be taken for 3 CME credits for an intro to integrative oncology. It's probably going to sound a lot like this talk, and I think it's $90, so it's very affordable. The Osher Center for Integrative Medicine highlights Donald Abrams, who was also a fellowship graduate, and he's a teacher there now as well. They actually have 4 videos at the end on different integrative approaches to cancer care with him talking about them. They're great. The last one is on medical marijuana. There's a Society of Integrative Oncology and a couple of others that have great reputations and good resources for herbal medicines and supplements. And with that, I'd say thank you.